Good afternoon, Peter Goertz. I'm a psychiatrist. So, trauma manifesting in psychiatric problems, how could trauma not manifest in psychiatric problems, one might ask oneself. But some people are very resilient, and even after a severe trauma, emotional trauma I'm talking about, they do not manifest any major psychiatric issues. So it's quite interesting as far as some people manifesting psychiatric issues and some people not, even if they've been through similar or even the same trauma. I mentioned the story about the elevator that I was stuck in with 11, I think total of 11 people, and different people had totally different reactions in the moment. So one could think that afterwards also different people had very different consequences of that experience. So one could see psychiatric issues after trauma almost like a translation of past trauma into daily life, in a sad way, of course. And what started me on thinking about this and talking about this today is yesterday I saw a patient, a young lady, and she was hearing voices, she was depressed. I saw her in an emergency room, and she'd been physically and sexually abused and was in quite a bit of distress, and I was evaluating her. Now, if someone's been physically and or sexually abused, one can be pretty sure there's also been emotional abuse and possibly neglect also. And she, unfortunately, as a psychiatrist or as any kind of doctor really, you're going to see she's not alone. There are many, many, many patients you're going to see who've been traumatized in childhood and further on in life, and they're connected also. If someone's been traumatized in childhood, of course, they're more vulnerable to being traumatized later on in life. And you're going to see certain types of patients with a high percentage of being traumatized in the past. For instance, people who use alcohol or drugs, people who are incarcerated in prison. Those are populations where there's a high percentage of past trauma, for example, in childhood. As far as psychiatric diagnoses, two common psychiatric diagnoses, and one of them is very common, the borderline personality disorder diagnosis. So two diagnoses in psychiatry almost always signify that someone's been previously abused in their life, generally in childhood. And those two diagnoses would be, or categories of diagnoses would be dissociative disorders like dissociative identity disorder and borderline personality disorder. And dissociative identity disorder, again, pretty much always signifies that someone's been abused in the past. Other dissociative disorders maybe also, but probably less common than in dissociative identity disorder. And one could ask oneself, why is there so much trauma in this life, on this earth, in this world? And one pretty obvious reason is that the abusers have been traumatized. And of course, that's no excuse. If someone's been abused, that's no excuse for going on to abuse someone else. But in general, if someone does abuse someone else, that generally means, or very frequently means, that they themselves have been abused, for example, in childhood. But again, that's no excuse, because many people have been abused in childhood but do not go on to abuse other people. So that's one primary reason you could see as a reason why people are traumatized. But if you want to go deeper and ask more in general, why is there so much trauma on this earth? Why is this happening? And I've talked about these things before. If you want to ask on a deeper level, why is all this happening? Why is all this trauma occurring? One could say and this is what helps me to cope with all the trauma I see, or one thing that helps me, I see, or I try to see life at least, as one big learning center, like this earth as one big learning center where people are trying to learn emotional lessons, spiritual lessons, and those lessons can be very, very painful. But if you see it like that, as a learning center, then people do not, or it's not then a consequence for people to see themselves as victims. So by seeing life as a learning experience, which can be very painful, you avoid seeing yourself as a victim. Now, as far as treatment for trauma, that could be could be multiple other presentations, other videos. But one primary question is, do we want to address the trauma even with the patient? And if someone's psychotic, hearing voices, or paranoid, it's probably not a good time to address the trauma. And even if someone is high functioning, it's always good to leave it up to the patient as to whether or not now is a good time to address the trauma. And that can fluctuate. One day they may be ready, another day not, and that's something for a patient to gauge. Thank you.